Well, how many times have you focused on all the things wrong with the skin on your face, only to ignore what's going on just below it? Your neck can show the signs of aging just as easily. Thankfully, the team at Therese Aesthetic Medicine has several solutions, and we have Dr. Therese Stubb joining me once again. Hi, Dr. Ann.
Thanks for having me.
So how often do you have people come into your office and just say, I hate my neck, do something with this?
That is the title of a book called I Hate My Neck, and it's out there because women just notice the aging in the thinner skin in their neck. They may have taken great care of their face through the years, and we often put sunblock on our face, and we kind of just neglect our neck. And it's thinner skin that can age more quickly.
And what are some of the things that happen aside from it being thin? What are some of the issues people have?
Well, first of all, sometimes we gain just a little bit of a fatty pooch right under here, and that can come with age. It can be genetic. Some people have it. They'll say, geez, my Aunt Sally, my mom, everybody has this little pooch right here, and it gives people a little bit less of a profile. And so people object to that, and we have lots of good things to treat that. We have either you can freeze the fat with the Coolmini, a little handpiece that just sits there for an hour and freezes it, and the fat goes away over the next 3 months. We also have a wonderful injectable called Kybella, and Kybella is a brand new FDA-approved medication that dissolves the fat cells. It's injected into that little fat pad here, and I think we see a before and after picture here. Just that little pooch underneath the jawline there that gives people just a little bit less of a profile view. So by dissolving it, this girl had 2 treatments in order 30 days apart, and that just dissolves and the skin retracts there very nicely.
And what are as far as the length of the results for that? Do they have to go back and get that often?
That dissolves fat cells for good. So those fat cells are gone forever. We usually recommend 2 treatments to up to 3, depending on the size of the area. So we see people and kind of give them an estimate of how many of those treatments they'll need. An average is about 2 to 3 of those injections, 30 days apart. But you really do see a marked difference even at 30 days.
Yeah, that was huge. Okay, the other one, which we've mentioned before for other issues, Botox and Dysport, you can use those on the neck.
Yes, there's platysmal bands, this muscle that kind of, creates these bands in the neck here. And usually if someone looks in the mirror and kind of gives us an E, stretches those bands, we can see that in this picture, those bands tightening up. We can put a muscle relaxer, Botox or Dysport, in those little bands, very small amounts, and it relaxes them and gives the neck just a little less of a bony or, veiny appearance there. So those muscles relax. People can still talk normally, do all their sit-ups and crunches at exercise class. So it doesn't really affect the musculature of the neck in the rear. We can still do everything with our neck we need to do, but these little bands are just gone.
Okay, sounds amazing. Another one, we've gotten to know and love CoolSculpting, and you can use that to get rid of the double chin.
Yes, and so we can use that the same place we use the Kybella. We can use different hand pieces too to kind of address some of the fat on the sides, to kind of give people their jawline back. And I think this young lady, you can see that little bit of fat right under the chin, and then also just a little bit on the sides that we CoolSculpted as well to give her back her jawline there.
And ThermoSmooth, also something you can use on the neck.
Right, and so ThermoSmooth is just that radiofrequency deep heat applied to tissue to tighten it. And we often find that people, they kind of just take their hands and pull their neck backward and said, if I could just get a little bit of tightening. And then the texture of the skin gets kind of crepey, and we get those little horizontal necklace lines. So we can use some lasers, and then the biggest new thing to hit the cosmetic scene here is ThermoSmooth, which is the radiofrequency heat. And that's just delivering heat to the area of the neck. 1 treatment every 1 to 2 weeks for about 4 treatments, and that's the result you see there. Every bit of lines, every little one isn't gone, but much improved with the tightness. And that's something that people can do, annually, 1 time a year, just to build more collagen. Most of my patients are trying to stave off getting a facelift or any big surgeries.
Sure.
They want to do things that just I don't want to look, 15, but I want to look great for my age.
And Dr. Ann, 20% off neck treatments. That's the offer you have today,
yes,
too.
Because this is an area where women and men are just finding that it shows their age. So 20% off any of the neck treatments we talked about for your daytime viewers.
All right, Dr. Ann, as always, great deal. All the info up there for you. Thank you for being here.
Thanks for having me.